Hey, Dr. Brian Kinsella here, showing a quick drill that's really helpful for anyone who has to do rotation, whether this is in your sport or for some people in their job or occupation. And so often when rotation is involved, that's where we can get some knee pain or back pain, particularly back pain, if we're not rotating in the correct way. And so what we often see in folks who have some back pain with twisting is that they twist just from the low back. So their feet stay planted and they kind of turn from their belly or their belly button. And so the low back, the anatomy of the lumbar spine, the facet joints, the joints of the low back, they actually don't have that many degrees of rotation per joint. So anatomically, we actually can't get too much pure rotation out of the low back. Rotation primarily comes from our hips and from our shoulders and our thoracic spine. And so if we don't have the capacity to rotate through our hips, then if we force that rotation through the low back and we do that repeatedly, it can lead to some pain or some irritation. So in a lot of my patients with low back pain, this is a drill that I teach them to get them rotating through the hips. So for athletes, this can look like golfers, hockey players, baseball players, frisbee athletes, anybody that has to rotate. You're also going to be more powerful in this position because the hips are the big powerhouse of our rotational force, not the low back. The low back should stay fairly stable as we rotate. If you're in an occupation, I see this a lot in nurses, in anybody that has to move side to side, but particularly our healthcare workers, if you're boosting somebody up in bed and your feet are planted and I got to boost up in bed, if I just rotate through the low back, that can cause some pain. And if you're in a bent over position, that's one of the most common mechanisms for a strain of the low back. So here's the drill. What we're going to do is take, this is a PVC, whatever you have, a PVC, a broomstick, a dowel. If you're an athlete, a hockey stick. I've had golfers do this on the golf course with a golf club. Whatever you have, we want something that we're going to put behind our back. And I want to get some pressure to pull this into my low back. What I want to be able to feel is on either side here, I'm going to feel this PVC pressing into my back. So I have this tactile feeling of it across my whole back. So before I do anything, I want to make sure I can feel that on both sides. And then I'm going to rock it side to side and feel, what does it feel like when the PVC comes off that side and off that side? Here's center. Off, center. And what I'm going to be doing is I'm going to start rotating not through my arms, but through my hips. And if this PVC comes off, that's what I want to notice. Because if I'm here and I rotate just through my back, it starts to come off. But the drill is, I'm going to get here, you're going to get in the stance position of whatever position you need to rotate in. So if a golfer, you might be here. If you're a healthcare worker, approximate where that bed height is. Hockey player, maybe you're a little bit lower. Tennis player, maybe you're a frisbee player, maybe you're a little higher. So whatever position you have to be in, kind of get in that position. And then we're going to rotate through the hips, keeping points of contact on either side. So I'm here, and I'm going to rotate, and I want to keep the PVC on my back the whole time. What you'll notice is the only way to do this is by getting my toe off the ground. It's going to be very hard to do this if I keep my toes planted. There's only so much rotation I can do. And so I need to come up on my toe. And what we'll also see is in my finished position, rotating, my belt buckle and my sternum are facing where I want to go. So if you're a golfer, you got a backswing. For a right-handed golfer, I'm going to backswing to the right, and then I'm going to pivot, drive through. Left-handed golfer, I'm going to come here, pivot, backswing, drive through. Tennis player maybe, I'm going to come through the toe. So what you're going to see is that if you're pivoting through the back, you're probably not coming up on the toes, but you'll also hopefully be able to feel this coming off your back as you rotate. And so this gets the hips, low back, and shoulders all moving together. As a bonus here, if you're an athlete, you might start to notice some more power if you haven't been rotating in this way. Because the hip muscles are some of the biggest in the body, and if I'm coming through, That's where my power is going to come from. The power does not come from the low back because there's just not a whole lot of rotation there, and the muscles are not designed to fire through into rotation. So this drill works great as a warm-up if you're doing an activity that has rotation in it. But if you're having some back pain and rotation is part of your job or part of your responsibilities, your sport, get a stick here and let's just see. It helps if it's a little flexible, but it doesn't have to be. And just do, maybe 20 reps each way, not letting the PVC come off your back. What you might also feel is at the bottom here, a little stretch on the outside because we're pivoting into hip internal rotation. And you might feel a little capsular stretch there as we rotate through. So that's our rotational drill. Use it to develop some power out of your rotation, but also to reduce strain on the low back when something demands some rotation.